staggering but true, nearly 1 in 50 people live with paralysis, approximately 6 million people in the United States alone. Paralysis, a loss or impairment of voluntary muscle function, sparks fear and curiosity alike. It's a condition that can render the body a prison, trapping the person within. The causes are varied, ranging from genetic disorders and toxins to traumatic injuries. It's a complex condition that manifests in myriad ways, as unique and varied as the individuals it affects. Today, we embark on a journey to explore 10 terrifying ways one can become trapped within their own body. These conditions, while rare, throw light on the unsettling reality of paralysis. They underscore the fragility of our bodies and the fine balance that keeps us moving, breathing, living. So brace yourself as we delve into these 10 terrifying conditions that can lead to a life-altering state of paralysis. Imagine waking up one day, unable to move. This is the reality for those suffering from periodic paralyses. This condition is a group of rare genetic disorders that lead to muscle weakness or paralysis, which can last from minutes to days. These episodes often begin in childhood or adolescence and can be triggered by factors such as rest after exercise, high carbohydrate meals, and even sudden changes in temperature. The cause? Mutations in genes that regulate ion channels in muscle cells, resulting in an imbalance in the flow of ions and hence interrupting normal muscle function. Symptoms can vary but typically include muscle weakness, irregular heartbeat, and in severe cases, paralysis. As for treatment, it's mostly about managing symptoms and triggers. Lifestyle changes like a low-carbohydrate diet and regular exercise can help. Some medications can also prevent or reduce the severity of attacks. But here's the catch: there's no one-size-fits-all treatment. The unpredictability of this condition makes it a truly terrifying way to become trapped in your own body. A single bite from a tiny creature can lead to a condition known as tick paralysis. Picture this: a minute, almost invisible creature latches onto your skin, releasing a toxin that slowly seeps into your bloodstream. This is the unsettling reality of tick paralysis. Here's how it works. Certain female ticks, when feeding, produce a dangerous toxin. As this toxin enters the bloodstream, it begins to affect the nervous system, disrupting communication between the nerves and muscles. This disruption, in turn, leads to the onset of paralysis. Symptoms typically begin with weakness in the legs, which gradually ascends to the upper body, arms, and head. If left untreated, this condition can lead to respiratory failure and in rare cases can be fatal. The frightening part: the paralysis continues to worsen until the offending tick is removed. And while tick paralysis is more common in domestic animals, humans, especially children, are not immune. The good news, though, is that the removal of the tick generally leads to a full recovery. Tick paralysis underscores the fragility of our nervous system and the impact even the smallest creatures can have on it. ALS, also known as Lou Gehrig's disease, is one of the most well-known and feared causes of paralysis. This neurodegenerative disorder attacks motor neurons, the nerve cells responsible for controlling voluntary muscles. Over time, as the neurons deteriorate, they stop sending messages to the muscles, leading to muscle weakness and eventual paralysis. Symptoms often start subtly, with slight muscle weakness or difficulty speaking, swallowing, or walking. However, the progression of ALS is relentless, with most people experiencing significant disability within 3 to 5 years from the onset of symptoms. While there are treatments that can slow the progression of ALS and manage symptoms, there is currently no cure. This is primarily due to the complexity of the disease and the fact that its exact cause remains unknown. Researchers are tirelessly working to uncover more about ALS, hoping to one day find a cure. The rapid progression and incurability of ALS make it one of the most terrifying conditions leading to paralysis. A sudden inflammation of the spinal cord can lead to a condition called transverse myelitis. This isn't your everyday back pain. We're talking about an attack on the insulating material covering nerve cell fibers, the myelin. This inflammation disrupts the messages that the spinal cord nerves send throughout the body. So, what causes it? It's often linked to various infections, immune system disorders, or even a delayed reaction to vaccination. The symptoms? They can develop over hours or stretch out over a few days. Victims might experience pain, a sharp sensation that moves down the back and into the legs, muscle weakness, or even paralysis. They might lose sensation or experience bladder and bowel dysfunction. Treatment, you ask? It's all about managing symptoms and addressing the cause. Therapies might include medication to reduce inflammation and pain, plasma exchange therapy, and physical therapy to improve strength and coordination, but it's a race against time as permanent neurological damage can occur. The sudden onset and potential for permanent damage make transverse myelitis a terrifying condition. Curare, a poison used by South American tribes for hunting, can cause complete paralysis. This potent substance found in the bark and stems of certain tropical vines has a long and fascinating history. When introduced into the bloodstream, curare binds to the nerve endings at the junction where nerves meet muscles, blocking the transmission of nerve impulses. The result? A terrifying descent into full-body paralysis while consciousness remains untouched. Imagine being fully aware, yet unable to move a single muscle. This paralysis begins with the smaller muscles, like those in the face and neck, before progressing to the arms and legs, and ultimately, the muscles that control breathing. Despite its terrifying effects, curare has also been utilized in medicine. In controlled doses, it was once used as a muscle relaxant during surgery. Today, synthetic versions of curare are used, as the original substance can be too unpredictable. In case of accidental exposure, treatment focuses on maintaining the patient's ability to breathe while the body metabolizes the poison. Antidotes do exist, but their effectiveness varies. The potency of curare and its ability to induce paralysis is a stark reminder of the power of nature. Spinal cord injuries, often resulting from accidents, can lead to partial or complete paralysis. These injuries occur when there's damage to any part of the spinal cord or nerves at the end of the spinal canal. This damage often causes permanent changes in strength, sensation, and other body functions below the site of the injury. The symptoms vary widely, from pain or an intense stinging sensation to paralysis or loss of control over certain body functions. Some people might experience difficulty breathing or controlling their bladder and bowel movements. There's a range of treatments available, though full recovery isn't always possible. Immediately after the accident, the focus is on preventing further injury. This might involve immobilization or surgery. Later, various therapies and medications can help manage symptoms and improve quality of life. Research is ongoing, with scientists exploring new ways to prevent, treat, and even reverse the effects of spinal cord injuries. These include experimental treatments like nerve cell transplants and electrical stimulation. The suddenness and life-altering impact of spinal cord injuries make them a truly terrifying cause of paralysis. Eating your favorite shellfish can sometimes lead to a condition known as paralytic shellfish poison. This is a form of food poisoning not caused by the shellfish itself, but by a toxin produced by certain types of algae that the shellfish consume. When humans eat these shellfish, the toxin can cause a rapid onset of paralysis. The symptoms can range from mild tingling and numbness in the lips, tongue, and fingertips to severe muscle weakness and difficulty breathing. In extreme cases, it can even lead to death due to respiratory failure. The severity of the symptoms usually depends on the amount of toxin ingested. The frightening aspect of paralytic shellfish poison is that there's currently no antidote. The main treatment is supportive care, which may include mechanical ventilation if the person's breathing becomes too weak. To avoid this terrifying condition, it is essential to heed public health warnings about shellfish consumption, especially during harmful algal blooms. The unexpected onset of paralysis from a seemingly harmless activity like eating shellfish is truly terrifying. Succinylcholine, a common drug used in anesthesia, can sometimes lead to temporary paralysis. This muscle relaxant, often used during surgical procedures, works by mimicking a substance in our body called acetylcholine, which transmits signals from nerves to muscles. By doing so, it causes the muscles to relax and prevents them from contracting. But here's the catch. If given in high doses or in individuals with certain genetic conditions, succinylcholine can lead to paralysis. This happens when the drug continues to act on the muscles even after the surgical procedure has ended. It's a chilling reality that something designed to help can potentially cause such a terrifying outcome. Thankfully, this is a rare occurrence and medical professionals monitor its use closely. In the event of succinylcholine-induced paralysis, treatments are available. These can include the administration of other drugs to reverse the effects, or mechanical ventilation to assist with breathing if the respiratory muscles are affected. The potential for a common medical procedure to lead to paralysis is a scary thought, but it's important to remember that this is an exception and not the rule. The vast majority of patients receiving succinylcholine do so without any such complications. The human body is a complex, delicate system that can be affected in ways we can't even imagine. We've journeyed through the unnerving reality of 10 conditions that can lead to paralysis, each with its unique causes, symptoms, and treatments. From the rare and mysterious periodic paralyses, to the alarming tick paralysis, to the relentless progression of amyotrophic lateral sclerosis, or ALS. We've delved into the unpredictable world of transverse myelitis, the deadly effects of Curare poisoning, and the life-altering implications of spinal cord injuries. We've also explored the dangers lurking in our oceans with paralytic shellfish poison and the double-edged sword that is succinylcholine use in medical procedures. Each of these conditions underscores the complexities and challenges associated with paralysis. They serve as a poignant reminder of the importance of understanding these conditions, not just for medical professionals but for everyone. They help us appreciate the intricacies of our bodies and the importance of medical advancements. Understanding these conditions can help us better appreciate the intricacies of our bodies and the importance of medical advancements. Please subscribe to Unbelievable Top 10 for more fascinating insights into our world.